This podcast is sponsored by Talkspace. You know when you're really stressed or not feeling so great about your life or about yourself? Talking to someone who understands can really help. But who is that person? How do you find them? Where do you even start? Talkspace. Talkspace makes it easy to get the support you need. With Talkspace, you can go online, answer a few questions about your preferences, and be matched with a therapist. And because you'll meet your therapist online, you don't have to take time off work or arrange childcare. You'll meet on your schedule, wherever you feel most at ease. If you're depressed, stressed, struggling with a relationship, or if you want some counseling for you and your partner, or just need a little extra one-on-one support, Talkspace is here for you.
Hey all, Jonathan from Go-To Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go-To Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GoToHealth at checkout. That's code GoToHealth at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
Plus, Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance? No problem. Now get $80 off of your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go-To Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks. Welcome back to Go-To Health Media. Most of us have experienced a friend or relative who's been seriously ill. You then know that seriously ill patients often juggle many doctor visits, complicated medication schedules, and care instructions. They also experience a range of emotions that comes with navigating complex condition management. Serious illness can also affect patients financially, of course, because it's common for people with these conditions to end up in the hospital or emergency room on multiple occasions. The goal of palliative care is to improve patient well-being and provide comprehensive wraparound support throughout their entire journey. And when loved ones choose palliative care, caregivers can also get the help they need to better take care of themselves. With us today is Dr. Bill Logan, MD, MBA, and MHS. He is the National Medical Director for Palliative Care Services for Carelon Health. Dr. Logan previously served as Chief Medical Officer for the Medicare Advantage at Blue Cross and Blue Shield of South Carolina and for the South Carolina Health Plans at Centene Corporation. Prior to that, Dr. Logan served as a National Medical Director and Clinical Lead for the National Palliative Care Strategy at Humana. If you want to find out more about Dr. Logan's program, you can go to carelonhealth.com/palliative care. And let me spell that. It's Carelon Health. It's C-A-R-E, like care, Carelon, Carelon Health/palliative care. And that's Palliative. Welcome to the show, Dr. Logan. How are you today?
I'm well, Jonathan, and thank you so much for having me.
Sure. So let's start out with a definition. What is palliative care?
Well, Jonathan, palliative care is, at its most basic, a medical specialty that is specifically focused on relieving suffering. So a lot of folks will include palliative care or think of hospice when they think of palliative care. So all of hospice care is palliative care, but all of palliative care is not hospice. So palliative care can be applied literally at any time during a serious illness journey to support both the patients and the caregivers in that journey.
Good. And tell us a little bit about how the caregivers are supported, because they're just coming in to visit occasionally. How does palliative care support caregivers?
You know, any of us who've been a part of a serious illness journey, and I think probably many of your viewers and listeners have been a part of that type of journey with a loved one,
yes,
know that when that loved one is suffering, the caregivers for that loved one suffer as well.
Mm-hmm.
When you bring in palliative care, when the palliative care team supports that patient, they also support the caregivers. And that can be an absolutely essential part of helping that caregiver have the emotional strength, the physical strength, and the resources that they need to really help their loved one have their best life, even in the context of a serious illness.
Now, is palliative care offered only in hospital, or can it also be offered in home or at a specialty care center? What's the breadth with which these services can be offered?
That's another great question. So palliative care is available in most hospitals now. So if you are in a hospital and you're suffering, you can ask for a palliative care consult. You can also get palliative care in a clinic setting, and often you'll find it integrated into the office with oncology or cancer physicians, sometimes neurology, sometimes cardiology. So there are a lot of different places in that type of outpatient or inpatient environment where you might find palliative care. Carelon Health Palliative Care is unique in that we are strictly home-based palliative care, and we're the largest non-hospital, non-hospice, home-based palliative care provider in the nation. Wow. And we provide all of our services in the home where the patient lives. So that's a pretty important part of our care model, because as any provider knows, you tend to get either the best or the worst side of folks when you see them in a clinic or a hospital. They live at home, though. So there's so many other aspects of that person's life that you get to touch when you provide that care in the home. And having our providers in the home with the patient and their caregivers is a very unique advantage that we have. So we can really see a lot more and provide better support for those folks in that serious illness journey.
I'm so impressed with that.
There are others who do this, and many hospices will also provide some palliative care before someone goes on hospice, but we're the largest non-hospice, non-hospital provider of palliative care in the home in the nation. We're in 42 states, we're licensed in all 50. And we have the ability to provide that care in all 50 states. We've got a little over 23,000 patients on service right now.
Wow, that's really amazing. So people, no matter where they live in the United States, can get palliative care from Carelon Health.
Absolutely.
What is included in palliative care for the patient? Tell us what's the breadth of that care?
Some people think of, when they see a medical specialist, they just see a doctor. Our palliative care modern clinical model is a multidisciplinary and interdisciplinary team. So When they become a patient with Carelon Health Palliative Care, it's a physician-led model. So there's a palliative care physician leading the team. There's a nurse practitioner that is providing a lot of that care, boots on the ground.
Mm-hmm.
We have social workers that are integrated by geographic region to support those patients in their social determinants of health and in many of their special needs. Those social workers are also qualified to provide behavioral health support. And then we've got two different teams of nurses, nurse case managers and a nurse triage team that provide 24/7 provider call support, like a physician call, all the way across the country by time zone. So when you become a patient with Carelon Health Palliative Care, you have the access to our providers 24/7. And that is an absolutely, you just can't value how much that can benefit a patient and their family.
Yes, having been through this, I know how unpredictable a health journey can be. That's absolutely amazing that you can do that. So hearing all this sounds very expensive. Do people pay for this privately? Is this covered by any kind of insurance, Medicare, Medicaid? What kind of coverages are there? Hey all, Jonathan from GoToHealth. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For GoToHealth listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GoToHealth at checkout. That's code GoToHealth at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
Most of our patients currently fall under the care of one of the Elevance health plans. Elevance or Anthem health plans.
Anthem.
And that's Medicare, Medicaid, and then they have a large number of commercial health plans too that we provide for all of those different lines of business. We also provide for many other health plans across the country that are not Elevance health plans. So there are many health plans that pay for that. So most of the patients that we see, that service is covered as a part of their benefits and it doesn't cost them anything. There are some of the plans that would have a copay or a co-insurance payment, and that would be something that they would need to investigate with their own insurance payer.
I just know that, with all that you go through during a person's serious illness, the last thing you want to be worrying about is finances. So it's great to know that it's covered. Tell us, what is advanced care planning?
That's a great question. Advanced care planning is something that I recommend for 100% of my patients. And I really recommend that people do this when they're well. It's a deep conversation that you have with your trusted health advisor, whether that trusted health advisor is your primary care physician, your primary specialist, if you have a particular specialist involved, like a cardiologist or a neurologist or an oncologist. Those physicians can provide that advanced care planning, or a palliative care physician or team member. Advanced care planning is simply a deep discussion between the patient and that trusted health advisor, where the patient has an opportunity to say what they do and don't want during that healthcare journey. So as many of us know from our own healthcare experience or from the experiences of a loved one, there are many things the healthcare system can do. There are lots of things that people would not like to have done, like potentially tube feeding or machines keeping them alive. Those are the kinds of things that you would include in an advanced care plan, and that allows the patient's voice to be heard, even if that patient doesn't have their voice because of the illness or because of some event that occurs during their journey. So that advanced care plan supports the providers of their health care to make sure that they're doing what the patient wants. And it also supports the caregivers and loved ones so that the difficult decisions that sometimes crop up during the process of an illness journey.
Hey all, Jonathan from Go2 Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go2 Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GO2Health at checkout. That's code GO2Health at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
The patients had that voice already through the advanced care plan, and the family and caregivers know what their loved one wanted, and they don't have to try to guess.
So let me ask an honest question. I haven't been seriously ill. I don't know how I want to be treated. So how do I make these decisions? I mean, is there a guide, like do not resuscitate or tube feeding or keeping me on a breathing machine? Where do I get advice on how to make these kinds of decisions? I don't know.
That's a fantastic question. So the first place that I would go is to your health provider, but then I would tell you that there are also places you can learn about this. Each state has a unique set of specific documents. So you can go online in your state to a legislative website. For example, in Alabama, their legislature has put some things in place. South Carolina has specific things in place like that. One of the documents that's almost universally recognized across the nation is something called 5 Wishes. That's a document that you can access online, and it has specific questions that will guide you through that thinking. And all of us are at different places, Jonathan, so you may not be at the place where you're ready to make certain decisions yet, and that's okay. But as you go along, your advanced care plan can change, and it can evolve as you age and as you move along your life journey and any illness journey that you might experience. So it's very important. The other site that I would call to everyone's attention is there's an organization called mydirectives.com that you can go to online, and it's free to patients. You can complete your own advanced care plan and even leave a video message for your loved ones on that website.
That sounds like a fabulous resource. So tell me, doctor, how is palliative care different from hospice care? what drops off or what goes away when you move from palliative care to hospice care?
So all of hospice care is palliative care,
Yes.
but all of palliative care is not hospice. Hospice is two things. It is end of life care specifically. It's a philosophy of care that focuses on comfort and quality of life first. As we're in the healthcare system before hospice, we're often focused on trying to fight or cure illness.
Hey all, Jonathan from Go2 Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go2Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code Go2Health at checkout. That's code Go2Health at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
When we reach that point where we have, if that disease process that we have, if that disease were to work its own course out naturally, if we and our healthcare provider agree that we have about 6 months of life left, then you can make the decision to move to hospice care.
Mm-hmm.
You have to, not just you as a patient make that decision, but your healthcare provider has to certify that you are qualified then by that end of life state for hospice care.
Mm-hmm.
And 2 things happen then. Hospice care is a separate payer source under most circumstances. So Medicare has a specific pay source for hospice care. And that's important. So Medicaid often has that, and commercial insurance often has that as well. So it's a separate pay source and the philosophy of care. So when you make that decision, you move over into that care. Hospice is a very wraparound care source too, but the focus of that care is just comfort. When you're just receiving palliative care before hospice, you can also be receiving curative treatment for any illness that you might have. So that palliative care can come alongside your primary provider and your primary specialist to really help you with the suffering that comes from the disease and from the treatment of the disease. And might I say too, also from the complicated healthcare system that many people find confusing. So it's a coordinating service that wraps around folks before that end of life care that helps to support them for their best experience of life.
Thanks for explaining that. You used a term before that I wanted to ask what you meant. I know this is an upcoming term in healthcare, but I don't think most of the people know about it. Social determinants of health. What did you mean when you said that?
Oh, that is a wonderful and rich question. So great question. Thank you, Jonathan, for asking that. It has come to the fore in healthcare delivery that not everyone has the same resources, social resources, which means your support system from your family and friends. Not everyone has the same financial resources. Not everyone has the same living situation. Not everybody has the same insurance and support for their health care. All of those things, all those different domains, anything that is potentially limits or enhances that person's ability to receive health services or just basic daily living needs, those are social determinants of health.
Okay.
And those are things that the healthcare system prior to a few years ago really didn't necessarily acknowledge. And more, the healthcare system is acknowledging that some of those basic needs, a great, safe place to live, good food to eat, finances to support you, that those can be even bigger impactors of a person's health than a disease.
Got it.
So that's why they call them determinants of health, and social in that they cover all those domains that are sort of outside of what we usually think of strictly as healthcare.
So do I understand that does the healthcare system kind of check into what the status of a patient is? They may be richer, poorer, good living situation, bad living situation. Is there something the healthcare system can do to improve the situation? What does a social determinant of health mean? What impact does it have on the care you get?
Oh my goodness, that's an even richer question. So I'm going to start with the toughest one. Can the healthcare system do anything about it? And the answer to that is sometimes yes and sometimes no. But our communities have resources in them many times for lots of different supportive needs. So one of the things we have as a part of our interdisciplinary team with our palliative care teams at Carelon Health Palliative Care, we have social workers who are integrated into those teams by geography. So they know the communities that patients live in, and they're able to, as we discover those social determinants of health, they can help that patient find resources in the community to support those, whether it's support from a community agency for funding for heating or food or housing or transportation.
Hey all, Jonathan from Go-To Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go-To Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GoToHealth at checkout. That's code GoToHealth at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.
Or just simply a support network. One of the groups that we access frequently is a group called Catholic Charities, and they are very deeply involved in companionship for older adults. It's a really wonderful organization. The Alzheimer's Association and Foundation to support people with cognitive disease, those sorts of things, because the community will need to get involved in the care of that person to support many of them. Because as you asked, Jonathan, the healthcare system itself is not able to be the funding source or the provider for a lot of those services.
Right. Good. Thanks so much for explaining this to us today. We've been talking with William Logan, MD, MBA, MHS. He's the National Medical Director for Palliative Care Services for Carelon Health. And Carelon Health provides these kinds of services nationwide, in-home, and it's really quite an amazing opportunity that you should look at if you come in need. And you can learn more about this at carelonhealth.com/palliative-care. That's CARELON, carelonhealth.com, palliative-care. Thanks so much for being with us, Dr. Logan, today. It's been very, very helpful to share this information.
Jonathan, thank you. And thank you for your great questions. That was awesome.
My pleasure. Thanks so much. Remember, everybody, next time we'll be here with another informative session. And remember, go to health. Take care. We'll see you again soon.
Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.